When pain is keeping you from taking part in the activities that you love, there is a place you can turn. Today, Dr. Orbegozo from Florida Pain Relief Group is here to discuss how they can help relieve your back pain. Good morning, doctor. How are you?
Very good, thank you.
I'll say I'm really dealing with a lot of back pain these days. I mean, I have no idea why I would have back pain. No, kidding aside, there are so many people out there that do struggle with back pain. What are the causes and how can you offer help?
Well, the causes of back pain are multiple. There are so many structures in the back that generate pain, including intervertebral discs, bone, ligaments, nerves, membranes that cover the nerves. So basically, it's a diagnostic process, and it includes obviously well, seeing the patient, doing an examination, doing some imaging studies, whether it's a CAT scan or an MRI. And then doing some diagnostic injections and blocks to find out exactly where the pain is coming from.
You know, I'm curious, when is the time that you're just like, oh, I've got a twinge or something's not right back here, I'm just going to keep moving on and going on with my day-to-day life, or no, this is now a problem I need to call? Can you kind of help people navigate that time frame?
Yes, absolutely. So the most important thing is, or one of the things to understand is most back pain will go away on its own or with a little bit of exercise or a little bit of therapy. When the issue does not go away and it starts worsening after a matter of 2 weeks, 3 weeks or something like that, then it's something to consider seeing a physician for. One. Number two, it's if the issue is causing symptoms down the legs, like numbness or tingling down the leg or weakness. It's very important to consult a physician at that point, or if there is any kind of bowel change habits or something like that, or urinary change in your urinary habits.
Really?
Yeah.
That can be affected by back pain?
Absolutely. I mean, if it's a disc in the lumbar area, the lumbosacral area, they course with some changes in.
Interesting.
Yes.
Very interesting. Well, if you notice big changes, it's time to call. But say you're already in the process of getting treatment. How do you really know if treatment is working, or if maybe you need to go a different path?
Yes. So this is, as I said before, a process where after we go through some diagnostic testing and we figure out which is the structure that's causing the most pain, and we try to treat it very specifically. So we see the patient in follow-ups after we do these diagnostic tests, and we evaluate. We see, well, how much relief did you get from this injection, whether you got relief or not. And then we just continue down our process of elimination, basically.
You know, we're running short on time, but one thing I want to ask is, how can you tell? I mean, sometimes a regimen to get better, whether it's medication, it's sometimes hard to follow. How can you kind of assist that for patients and make sure that they're doing it correctly?
In terms of medication, yeah. Well, in terms of medication, we have several options in terms of pain management. So there are non-narcotic medications and they're narcotic medications. So we usually start with the non-narcotic medications, anti-inflammatories, some muscle relaxants, etc. And then if the pain doesn't go away, it turns into a chronic process after a matter of months. Then we have to start something stronger for the pain. So we see the patient for evaluations every month. We do a DNA testing to make sure that the patient actually metabolizes the medication correctly, and it's going to work correctly.
Interesting. That DNA one's really interesting. Well, thank you so much. We appreciate you guys coming in and breaking this down. And if you want more information on how Florida Pain Relief Group may be able to help you, just give them a call at the number on your screen or visit floridapainreliefgroup.com.